Hi everyone, it's Kirsten Pilati from Breast Cancer Network Australia. Thanks for joining us. Well, we know that in recent days we've seen significant media attention about Elle Macpherson and her breast cancer. We know that there have been many discussions about her treatment decisions and the impact that breast cancer has had on her and her family. When public figures discuss their health experiences, it brings certainly valuable attention to important issues. But we also know that it can highlight some risky choices and some very difficult ways of describing breast cancer through the media. We believe it's our role that these discussions don't lead to any doubt or to any fear that you may be feeling as someone who's been affected by breast cancer. Our priority as an organisation is to ensure that you feel empowered and informed in the choices that you make following a breast cancer diagnosis. Breast Cancer Network Australia advocates for the importance of accessing trusted, evidence-based information to guide treatment decisions. While a healthy lifestyle, including good nutrition, exercise and mental wellbeing, plays a critical role in cancer care, we really want to emphasise the importance of consulting your healthcare professionals and relying on the expertise of your treatment teams to make informed decisions for you. Our role today is to cut through the noise and help you to navigate what is, we know, a very stressful time, not only in your life, but when these kind of messages emerge through the media. So today we are joined by clinical psychologist Dr. Charlotte Tottman, and our plan today is to cut through the noise. Charlotte certainly brings a unique experience, both from a clinical perspective, but also personally. And I know many of you will have heard from her and of Charlotte through our incredible podcast series, Upfront About Breast Cancer, What You Don't Know Until You Do. Welcome, Charlotte.
Hi, KP. Good to be here.
It's been a big few days for people. Tell us why media attention really does trigger so many emotions for our network and for those people around them who love them very dearly.
I think this has been a really big week, and the reason that I think the emotional response has been so visceral is because this is about big stuff. This is about like life and death, if you like. So we're not talking about, the shallow end of the pool here. And so that brings out really big responses in cancer patients, like anxiety and worry and fear. And I think it's bringing out a lot of anger in the people who care for them. And that might be their loved ones and it might be their medical teams.
And I think one of the real things that I have noticed from the network is this why me that we see through Elle's experience, but we've also seen through many other high-profile people, that real question of why me, what's caused my breast cancer, and I think that has yet again emerged through this media.
Yeah, I mean, one of the first things that happen when people are diagnosed is they search for an explanation, because if they can figure out why it happened, sometimes they can think, well, if I can get rid of that thing that caused it, then I'll feel safe. And particularly for people who have kind of felt like they've done the right thing, they've lived a healthy lifestyle, they've done all the things that their doctors have recommended, they've followed all of the kind of like good, healthy lifestyle advice, and they've still wound up with a breast cancer diagnosis. It can feel really unfair and really unjust.
So talk me through, I think we all know that when someone is diagnosed with breast cancer, the neighbour's got a view, they've got a story of someone 20 years ago who had chemo, and, we hear that through our network. But when someone so publicly comes out and talks about the choices that they have made for them, why? Why do we see this response of kind of judgment, of judging? And I feel like our network feels like they're being judged, then they're making a judgment back on someone else's decision. Why does that actually happen?
I think when someone who holds such a public profile and has, if you like, a lot of power, I can't imagine that she doesn't realise that she has that power, but I think that there's sort of a message that's coming through which kind of feels a bit like I did the right thing, and if you didn't do what I did, then maybe you did the wrong thing. And I think for people who have been or are going through the very gruelling experience of breast cancer treatment, the idea that someone would call that kind of like the wrong thing to do, or that, you know, whatever steps and choices you've taken to save your life should be judged, I think does not sit well with people at all. And then I think that's, honestly, I think that's fair enough to feel like that. And then I think that in turn, people are then judging the messenger, if you like. And I think that there are times when the judgment is perhaps maybe misplaced or not helpful. So if we were to judge anyone for their treatment choices, I think that's potentially a bit unfair, because everybody's experience is individual. They have a right to choose whatever they want to do for them and their bodies. But when their choices or their actions have the potential to harm others, then I actually think that it is actually correct and proper to call that out. And that's, I think, part of what we've got going on here. And so to judge someone for perhaps being a little fast and loose with the power that they hold, and I think calling that out actually is appropriate.
We know that we get misinformation all over the place, not just through media reports or high-profile people sharing their own personal experience. You know, what's our message to people about finding that trusted source?
Yeah, before I answer that question, I will say that we know that anxiety rises with the unknown, the unfamiliar and the uncertain, but the flip side of that is that we know that anxiety comes down with good quality information. It's not any information, it's good quality information. So it is about becoming like an educated consumer and understanding that not everywhere that you go for information is going to provide good quality information. We know for sure that there are some trusted outlets like BCNA, for example. We know that peer-reviewed journal articles are good, although they can be pretty hard to interpret if you're not across that stuff. But the God's honest truth is, like, the place to get the best quality information for your specific situation is your medical team, and that everybody else's experience might be interesting. It might make you curious and perhaps want to ask questions or investigate treatment options. But I think it is always so important to hold on to the reality that, you know, two people could have the same demographics, the same cancer diagnosis stage and presentation, possibly even similar pathology and similar treatment, and end up with a completely different result. So the idea that we would go just because it worked for so-and-so, that it's going to be the right thing for me, is a fallacy.
What are some of the things that we know that this is generating a lot of conversation in the community, but anyone's diagnosis creates a lot of conversation? What are some of the things you can kind of have in your toolkit to thank people for the information they might have given you, but actually be clear in your own mind that, you know,
yeah,
thanks but no thanks.
Thanks but no thanks,
Yeah.
absolutely. So this is where I make the distinction between intent and delivery. So most of the time when people put forward their hairdresser's solution or their cousin's experience or whatever, they're doing it with good intent. They're not trying to be harmful. They're not trying to give you a bum steer. They're trying to suggest that, like, you know, you might want to think about this, or this, you know, this saved her life, so therefore maybe it'll save yours. So sometimes it's about remembering that the intent is good, even though the delivery might be clumsy, like my clumsiness there. But we get, as humans, we get hung up on the delivery. So if somebody's kind of like really enthusiastic and in your face and you're like, whoa, 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 it can be hard to see that the intent is good behind that. The second thing is to just always hold on to the fact that, like, my stuff is my stuff. And whilst it can be important and interesting to hear about other people's stuff, it's not my stuff. Having said that, if somebody does say something or gives you information, or you hear or read about something, and it is kind of like a bit interesting and it might sound like it might relate to your thing, then talk to your team about it. Like, good surgeons, good oncologists will be open to discussing things, and, you know, not everybody has all of the right ideas at the beginning. So to be able to have an open and frank discussion about, I've heard about this thing, what do you think, is much better than like going off and researching it yourself.
I've kind of got... I would love you to take your clinical hat off, put your personal hat on. How do media stories like this land for you?
The first thing that it does is it ignites my fear of recurrence, because it reminds me, if I'm having a day or a week where, you know, I'm not thinking about cancer, it reminds me that I am one of those people and that I will always be one of those people. And it takes me back, and I get a bit emotional talking about this, but it takes me back to diagnosis and treatment, and then it makes me think about, like, I mean, for me, but even like in this case, even for Elle, like, well, what if, you know, what if it comes back? So it's a big fear of recurrence trigger. I think the other thing is that, you know, depending on the situation, but this week, for me, I think it made a very, what to me feels like a very big, difficult, complicated experience. It made it was trivialised, it felt like it was overly simplistic, and it felt a little disrespectful, and I didn't like that, and I don't want to bother spending a whole lot of energy on stuff that doesn't really matter, but in the moment I certainly did feel that. And I've had to kind of, like, you know, work through that, and I've been talking with my husband Rob about that, about like, why does it press so many buttons and why do we get so pissed off about this stuff? And I think a lot of it is because it is the life and death stuff. This isn't small beer.
So what are some of the practical elements? Because this is not our first rodeo in terms of media.
And it won't be our last.
Exactly, and this is certainly not... we know that the fear of recurrence, the fear of progression for people with metastatic disease is real. What are some of the things we can... And I know we talk a lot about this in the podcast, so I would encourage people to really get to go back and listen to your podcast, because even if you've only listened to it once, if you listen to it again, you'll get more and more tips. Yeah. But what are some of the things that, you know, that we really can do when we feel... Because it was an energy that was instant.
Absolutely. So I would make the distinction between there's stuff in the moment and then there's stuff a little bit further down the track. So when I say further down the track, I mean hours and days later. So in the moment, if you feel like you're having a really strong emotional response to something, and it's content, because a lot of this stuff was coming out in the media, so it was stuff that you're reading on your phone, it's stuff that you're hearing in your ear, it's stuff that you're seeing on a screen, and it's unlimited. There's so much out there, and I mean the articles just keep coming. I think that one of the things to do, and this is hard in the digital age, but is to set your device aside and actually take a break and just go, okay, if I'm feeling really angry or really anxious or really teary or really something and I can't even identify what it is, then I actually need to disconnect from where the source is and just, like, take a break. It's good to do some stuff like, you know, very simple things like breathe and go for a walk and, like, be out in the fresh air. All of those very simple things are what are really good when you're in high distress. In terms of, like, what to do in the days that follow, and this is kind of like what I've done with Rob, is to try and identify, first of all, the feelings. So, like I was saying before, I think there's anxiety. And there's parts of anxiety, so there's fear and there's worry, there's anger, and within anger there are parts to that. So there are people who feel insulted, there are people who feel rage, there are people who feel like this is a threat. So it's about trying to drill down and think, okay, what exactly is the feeling that I'm feeling? Interestingly, there are even people who are now feeling self-blame. So there are people, and I read an article this week from a lawyer who said something, I'm paraphrasing here, but something along the lines of, in all of her time dealing with her cancer experience, it had not once occurred to her that she might be responsible somehow for this, and yet now, because of what's happened in the last week, she's starting to then look at her own stuff and blame herself, which is so not okay. So I think it's about identifying what the feeling is. If you can name it, this sounds weird, but putting a name on it does make us able to move on more quickly from the emotion. And then the next thing to do is to try and figure out what's the driver for the feeling. So what is it that's really got under your skin? Is it something that you read? Is it something that you saw? Is it something that you heard? And was it a sentence? Was it a word? Was it a behaviour? Is it the whole thing together? Rob and I call this like the hot thought. So what's the hot thought? What is it particularly that's really got under your skin? And if you can work those things out, what you're effectively doing is you're giving your emotional response an explanation. And we all do better with an explanation, because once you've kind of figured it out, it's like you can go, righto, I understand that. I can sort of move on from that now.
So how do you kind of manage, we know that there was a flood onto the online network where people wanted to talk and share experience with someone who understands, who gets it. What is that? What is that power that people find in that connection with other people?
So the word for it is empathy. But the reason that it's needed is because of this experience called emotional isolation that happens in cancer. So emotional isolation is best described by the feelings they just don't get it. And in the last week, I reckon there would have been a lot of cancer patients and cancer survivors who would have felt like, even though they've got loved ones all around them and they know they are well and truly loved and supported, this whole event would have triggered an experience in them that would not necessarily have been shared or understood by their loved ones. So then it spikes emotional isolation, which is where they feel like I'm kind of all alone in this really intense experience. And the antidote to that is to connect with people who get it, and the people who get it are the people who've been through something similar. And that's where the online network is so good, because it's like you just plug in and there's just all these people who know exactly what you're talking about. It's like a shorthand. You don't even have to persuade them. You don't have to educate them, because they're already there.
And I think that's that benefit of the online network. You can plug in and plug out when you need to plug out, and it's just like too overwhelming. I need to time out talking about my breast cancer. I don't want to be defined by my breast cancer, which I think is one of the really interesting things that this media article, and as we said, it's happened before, that kind of definition that people feel from it. We did a study around shame and breast cancer with Associate Professor Megan Brennan, and it really highlighted to me in a very strong way that actually women particularly who've been diagnosed with breast cancer have a sense of shame that happens in and outside of the healthcare system. Do stories like this really highlight or bring that back into, out from the shadows into, and what is that about?
I think I would say it's probably going to inflame any emotional response that people have around breast cancer. So for sure, if people are already feeling like shame, then it's like lighting a wick underneath it. So it's just dialing everything up. So if you're feeling shame, you're going to feel triggered around that. But similarly, if you're feeling fear of recurrence, you're going to feel triggered around that. If you're feeling isolated, you're going to feel that's going to be dialed up as well. So it's not kind of like, and that's unfortunately the power of the last week, is that it doesn't just affect one slice of this. It's kind of like across the board, and it's causing distress where there wasn't distress before, and that's not okay.
And I think one of the parts for BCNA is that there is an element of making sure that the media stories, which can sometimes, as you said, be very simplified, be very high level about someone's breast cancer, and there's so much we don't know through a media story, yet we all know the complexities of how important it is to know staging, pathology, to be able to inform decisions. But it is also about saying to people, yes, everyone will make their own decision, and kind of being okay with that. And I think that it is often very difficult when you've had an experience to want someone else to not have the same experience as you, or to be more like you. So, you know, I think, is it time as well for us as individuals who have been affected by breast cancer to kind of go, wow, this is what I'm feeling, this is why, and actually I need to kind of relax and look after me and control what I can control.
Absolutely. I mean, for sure, I have this I guess it's a strategy that I employ for myself as well as I try and encourage my clients to do it, which is when you're getting really bent out of shape about stuff that you can't control, is to step back from it and kind of ask yourself the question like, why does this really matter? And if there's something I can do about it, like, sure. But if there isn't, then, you know, what's it costing me? How helpful is this to me? And in this case, probably not overly, to be going around and around and over it. And so then it's about going, all right, I've probably given it all the resources it really needs and I can step back from it. The other thing that to be mindful of is that I do often say it's okay to feel the big feels. In fact, it's good to feel the big feels, and it's okay to think the big thoughts, even if some of those big thoughts are big negative thoughts. But you've got to be careful about when that starts to translate into behavioural change. And so one of the things that I've been really conscious of this week, and to be truthful, my worry is that people's particularly anxiety response around sort of self-doubt and second-guessing their treatment protocols is the risk that starts to translate into behavioural change, and that people then make different treatment choices off the back of what might be not a lot of good information and a very strong emotional response. And what we know about decision-making, any decision-making, but really very important in the cancer context, is that there's a big difference between emotion-based decision-making and information-based decision-making. And what we know is that of the two, emotion-based decision-making is the one type most likely to lead to regret. And I really don't want it to ever come to pass that someone off the back of this made an emotion-based decision to change their treatment and then years later had regret because there was a medical consequence of that which might in fact change the course of their life. That would be so wrong.
Yeah, and I think from BCNA's perspective, we absolutely want people to be evidence-based in their decision-making, go to trusted sources, keep within the healthcare system, keep the conversations happening, make sure that you are, everyone comes from a different worldview. Everyone does, but making sure that you have all the information to make the best decision for you is critical, but you cannot make that decision without knowing all of the evidence, and that's so important.
Yeah, and that making decisions when you are really emotionally charged is almost never a great idea. And the other thing I would say about all of this too, KP, is that when people get emotionally distressed, most of us switch into this thing called black and white thinking, which is where we kind of do, I'm going to do one thing or the other. It's kind of like always and never, that kind of thinking. And the risk is that with this stuff, people could go, I'm going to go conventional or I'm going to go alternative. The truth is that there is room for more flexibility than that. So even if people are thinking, do you know what, I want to explore something that's not conventional, it doesn't mean that they have to opt out of the medical system entirely. They can stay connected with screening, they can stay connected with follow-up bloods and scans and surveillance, and that with good support from their medical team, they can make choices that best suit them. So I think it's also important for people to know, OK, I don't have to turn my back on the medical system completely.
It's so true, and there are some incredible webcasts that we have done talking specifically about the difference between alternative and complementary, because as we say, the language, we know words matter. And the language in all of the media debate is so important to be able to cut through, and that's what we are here to do for you. So I'd really encourage people to access our website at bcna.org.au, use our helpline to help you navigate through, connect in with the online network and be able to share how you're feeling and be able to access the right information at the right time. But this is all about making sure that you are fully informed and make the very best decisions that is evidence-based, that comes from a trusted source, that is right for you at this moment in time, and know that you can always navigate in and out of the healthcare system. Charlotte, thank you. You're a true joy and such a treasure of BCNA. Please make sure you reach out and listen again to the podcast. We've had more than 200,000 Australians download the podcast, and there's a reason for that. It resonates, it connects with them. So thank you for your incredible advice yet again today. So reach out to the website, bcna.org.au, and please know that we are here for you every step of the way.